Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to Prime Health in life and in business. Today's episode is going to be fantastic as we have Dr. Patrice High from NuEmpowerment Health, and she will share how she is changing lives in both family and lifestyle medicine. But before we dive in, just a quick sponsor message from Grow Solutions, where we work to transform passionate healthcare providers like yourselves into profitable business owners without the overwhelm and guesswork, and allow you to enjoy life a little bit more. We do our best to eliminate the biggest headaches in their business, whether that's new patient or client lead generation. We have issues with communication. We can help improve that. Operational chaos using proven systems and frameworks. And of course, yes, we help you implement AI because it is changing quickly, even in the delivery of healthcare. So Grow Solutions is not an agency or vendor. We are a partner in your growth. So if you've ever thought this or said this to yourself, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we can help you with that. So just drop the word grow below. One of our staff members will reach out to you, or you're welcome to reach out to me on any of the social channels. But you're here for a reason today, and that's to hear from our special guest. I'm excited to introduce you to Dr. Patrice High. She's the founder and CEO of NuEmpowerment Health. She is a distinguished physician with over 20 years of primary care experience. Dr. High earned her Doctor of Osteopathy degree from Michigan State University College of Osteopathic Medicine and completed her family medicine residency in Lancaster, Pennsylvania. Now, Dr. High is a dual board certified in both family medicine and lifestyle medicine, so she knows her stuff, so pay attention today. She specializes in empowering women to prevent, improve, and in many cases, reverse chronic diseases. Her expertise spans conditions such as diabetes, obesity, hypertension, hyperlipidemia, early heart disease, Alzheimer's, and much, much more. Dr. Patrice utilizes evidence-based lifestyle interventions to help women achieve optimal health outcomes, not only for themselves, but also for their families. Now, having personally transformed her own health utilizing these principles, Dr. Patrice recognizes the limitations of the conventional Western medical model, which often prioritizes treatment over prevention. She believes that chronic illness not as really a result of bad genes, but can be addressed through sustainable lifestyle changes that enable women to thrive. By embracing these practices, Dr. Patrice achieves sustainable weight loss and experienced profound personal growth as a physician, wife, mother, and individual, and we're happy that she was able to do that. Now, her greatest passion is coaching women to prevent disease, reclaim their health, and enhance both the quality and quantity of their lives, helping them thrive, just not survive. So, Dr. High, welcome to the Prime Health Podcast.
Thank you very much, Derek. Thank you for having me.
Absolutely, dear. It's going to be a pleasure. As I said when we were talking prior to this, you're on the East Coast in the Carolinas, hopefully in some nice weather there today. A little chilly when I woke up, so hopefully we'll have a nice, warm conversation.
Sounds great.
All right. I always ask this at the start. Was there a moment in your life that said, you know what, that's what triggered me to make my career choice in medicine?
Yeah, so I don't have a specific moment because I was pretty young. I was about 6 when I told my parents I wanted to be a doctor. Which was strange because there really aren't any doctors in our family.
Okay.
Well, I guess there's a distant cousin who's a psychiatrist, but nobody immediately in our family was in the medical field. Okay. So I just sort of made a decision and just walked that decision out. I never really changed. I was always a kid who was helping somebody do something. So I guess that's what I thought was, that was the only way in the world that you can help people. This is where we are. And I wouldn't change it for the world.
Good for you. So when you first started out in medicine as an osteopath, did you start typically in the normal course, being in a hospital or a clinical setting?
I did. I went through a classic family practice residency. And then my first job as an attending was here in the Southeast. And I was still doing hospital work and clinic work within that practice. So yeah, I've been in the conventional medical model from for a very long time, for about
Okay.
all those 20 years. But also, I've worked in the federally qualified health clinic world.
Hmm.
I've worked in private practice. I've worked in hospital-owned practices. So I've had a little bit of everything in my career.
Well, that not only helps spice up your life, but it helps you as being a well-rounded physician for your patients too. Whether they know it or not, it's really helpful along the way.
We do
Yeah.
our best over here.
Yes, we do. We do for sure. So why is it important? Or let me ask this first. What was the transition in that practice in the clinical setting, which most people stay in, but you thought there was more to it? So what made that transition into lifestyle medicine?
Yeah, so my own health journey. I have been overweight and or obese most, if not all of my life. When I look back at pictures and see myself with the bags of chips as a little kid and what have you. But when I had my first and only baby, he came with a 30-pound price tag that I did not need. um, and one particular day, I don't know why we thought his bedroom should be at the top of the stairs, but we put his bedroom upstairs because we didn't know any better. And he was crying a cry that I'd never heard before. And so I went tearing up the stairs. There were about 12 to 14 of them. And I got to the top of the stairs and I was so short of breath, I literally had to stop at the top of the stairs. He's still crying. I still don't know what's going on, but I'm trying to collect myself at the top of the stairs. And I had never had that happen before. So in that moment, I wasn't sure if I was going to live long enough to raise this baby. I wasn't sure that I'm like, what kind of doctor am I that I'm not embracing my own wellness, but I expect my patients to do that. So I don't know if it was my mama hormones or what at that time, but I had all of those sort of moments at the top of the stairs. I collected myself probably, I don't know, 5 to 7 minutes. He was not dying. He's now 18. Spoiler alert. Um, but and off to college. But that was the day that I realized I needed to change for myself, for my patients, for every life that I was going to touch after that. So, like most type A people, I started Googling.
Okay.
And I came across, or doing a lot of research, Google was only part of it, but I came across the American College of Lifestyle Medicine, and here was this breadth of studies where they were reversing diabetes. And 20 years ago, we were taught if you were diabetic, you were always diabetic. So I'm like, why do I not know these things? Like, where have I been? I've been living under a rock. What's happening? And I was smitten. I decided to certify. I used all of the pillars of lifestyle medicine in order to reverse my own obesity. I was no longer short of breath running up the stairs.
Mm.
And I'm here 18 years later to talk about it.
Yeah.
And I want my
Well,
patients to know that.
yeah, I think that's important. I mean, unfortunately, what an impactful event to have that experience. But the truth is, how many people would you think that are out there that have that same exact experience
Oh, yeah.
after 5 to 7 minutes, got their breath back, just went on with life as it was? But
Right.
it was definitely impactful for you, probably because it affected your family so much, but you realizing that. So I commend you for that. That's probably wasn't the easiest journey at the beginning, but I'm sure, as you said, you're happy that you made it through that.
Oh, yeah, absolutely. It's changed the course of my life. It's changed the course of my business. And it's changed the course of how I navigate in the world, really.
Yeah. And from a parent to a parent, we only have a young child, well, he's 21 now. He's off in college. So I hope you didn't cry as much as I did when my son went away when he was a freshman. But
Yeah.
you modeled great health for your son. And I'm sure that he takes that onto his own life. And the same way as back in the 70s and 80s, we had commercials on TV with physicians smoking and drinking and promoting that stuff. And you're exactly right. How could you stay there as a physician and feel or look like you did? And I'm not saying anything about other people, but when we see that in ourselves and we want to change, that gives you the empowerment. So this leads me maybe into a question. When you deal with your patients that you do currently,
Mhm.
how much do you think how important do you think mindset is for them to make a change in their own healthcare?
Yeah, mindset's incredibly important. You have to start with that. And part of the reason why NuEmpowerment Health has 60-minute visits is so you have time to unpack that. You can't do that in a 15-minute visit,
Mm-hmm.
at least not in a useful manner,
Yeah.
not in an impactful manner. And so understanding people's why and the patient understanding their why is the beginning. Before we even talk about nutrition or even start unpacking all of the pillars, how did we get here? And what is your goal? Where do you want to be? And helping them future pace. And that's kind of my favorite part of it, is being able to help people sort of see like the process. Like most people blame themselves for being overweight or being diabetic or whatever your ailment is. And it's not your fault. We have all of these messages and now we get them from all kinds of places. Back in the day, you only had TV and it went off at like 11 o'clock, 11:30. You'd see the fuzz on the TV. But now we are inundated with messages that are unhealthy messages from all sorts of places. And so it's not your fault that you couldn't ignore the donut or whatever your guilty pleasure is. But it is inherent for you to recognize how you navigate if you want it to be different.
Okay.
So we start with mindset.
Okay. Love it. Love that approach. Do you feel in the conversations you've had with some of your clients along the way, is there a common misconception that they have about lifestyle medicine?
Yeah, I think they think that lifestyle is hard and it's too hard to implement. And I spend a lot of time helping people use simple, practical tools in order to shift things. It's not as hard as people think. And we've been conditioned, I would say, to believe that we have to go to a doctor's office to get a prescription before we even think about what's wrong with us.
Yeah.
And I just don't believe that's true. I believe that we have the inherent capacity to heal ourselves. I'm not anti-medicine, let me be clear. But there are certain things you definitely need medicine for. You break that leg, you want your pain meds. I get you. But what if we could just be in a world where we started with lifestyle and maybe we had less medicine? Some of us need medicine for lots of things, but I don't believe that all of us as we age need 10, 15, 20 medicines on our med list.
Yeah.
When we could just implement some really simple lifestyle things that are on a daily basis, truly.
So how do you approach it when people do have some of those misconceptions, but how do you approach their outcomes and their expectations once they enter your practice?
Yeah, so I feel like my practice is unique because my ideal client is somebody who's motivated to begin with. So she's either tired of going to the doctor and getting a new prescription every time she goes, or she's finally decided that she's ready to make inherent changes, or she's tired of being on medicine and wants to get off. So my practice is a little bit different than your classic medical family practice, just because I'm purposefully looking for people who are really wanting behavioral change support and accountability.
Okay.
And so really helping her understand her why, B, helping her understand how she got here, C, helping her understand where she's trying to go and what we need to do to get there is how we start off in my space here.
Do you have a mix, Dr. High, of patients that come in that are actually in good health, moderately good health, that want to optimize higher, and those that are coming that are in maybe in the condition you were in when you realized I need to make a change?
Yeah, I would say that the majority of my patients are the latter, because most people between 30 and 55 have already developed something, whether it's pre-diabetes, whether it's hypertension, whether it's my cholesterol's high, what are we going to do? I don't want to be on statins, whatever the thing is. So I think people tend to gravitate more into this space because they have a new diagnosis. Or they're looking at, or like me, I was looking at my family history. I guess that's the other piece I didn't share with you, is all the women in my family are diabetic at 40 on my mother's side, every single one of them. And when I had that episode at the top of the stairs, I was 35 years old. So I all of a sudden had a really important why for lots of reasons.
Absolutely.
And I think a lot of people sort of come to that. Prevention is not something that we've talked about a lot in the United States. We wait till somebody's sick in order to do something. Sometimes insurances won't pay for things until you're sick, and so they can get the procedure or what have you. And I think COVID taught us a lot. COVID was awful for a lot of reasons, but it also taught us some really important lessons. Like the healthier people tended to do better. They tended to live and not die. And so I really feel like we're at a space where people are starting to be more and more aware of their choices and how that affects their health, so that they might be ready for the next pandemic in a little different way.
Yeah.
Because it's coming. It's just a matter of when.
It's very true. I hope it's a long time in
I do
coming.
too.
Yeah. It's still been too quick since we're getting over it.
Agree.
Yeah. So in your practice, when somebody comes in, you're kind of talking to them about expectations. How do you think, because your practice is primary telemedicine, what do you do that helps you build trust with those patients to have them say, yes, I want to work with you to change my health?
Yeah. I try to be a really present, active listener, because I feel like most people, but because the majority of my patients are women, I guess I'll speak from that standpoint. Women need a place to be seen, heard, and feel valued. And that can't happen in a 15-minute visit.
So
They
true.
can't.
Yeah.
And so I think that just by giving them a platform to unpack what they're feeling, how they're feeling, and actually letting them choose what the goal is, letting them choose how we get there. I mean, my job is to explain the pillars and to explain the process. Your job as a client in my space is to decide what your goal is in the next 3 to 6 months, 6 to 12 months, depending on how you want to do things, and what are you willing to do to get there? And is that thing going to be enough to get you where you're talking about? And those are the conversations that we have. And people either love them or they don't. But we have more power within ourselves than we've ever given ourselves credit for.
Yeah, very true. You're testament to that as well, I'm sure. You brought up a great point right at the end there, Dr. High, in regards what are you in regards to your own healthcare willing to give and willing to give up? And that comes to mindset and probably other things that you talk about with your pillars.
Mm-hmm. It does. And I don't think that people have to give up a whole lot. I think they have to add some things. We talk way more about adding things to your plate, to your sleep, to your stress management than we do about taking things away from people. I think that's the other misconception that people have is, oh, I have to give up everything to be healthy. Well, you don't. You just need to add some things to crowd out some of those other things.
Yeah.
Mm-hmm.
From your practice, from your practice perspective, Dr. High, what is it that you are looking to focus on to grow your business?
Oh, I think I'm at the moment, I'm focusing on more visibility. So thank you for being here.
Absolutely.
I'm focusing on diversifying my business. I've got some speaking engagements coming up at some Veg Fest and a Health Expo in Atlanta before the end of the year. Because at the end of the day, I left conventional medicine because I wanted to have more impact than the classic, your patient walks in every quarter and they want you to just hand them a medicine that they're going to call you in 2 weeks and tell you that has a side effect and they're going to be miserable. And you know it, they know it, all the things. But I want people to know that they can just move a little bit to the left for it to be better, for their health to be better, and to generate leads that want that to be part of my community.
Yeah, love it. People that have that, like if you could look at a popular, when you're at Veg Fest, you have those people that are focused on that those are the clients, but how do you find people in your community across nationally that have the mindset that want to make a change, that have the desire to make the change and are looking for that are out there raising your hand and to try and get you in front of it. So I think that's a very high integrity and high ethics way in which you're approaching your business. And I'm sure, again, that once the client finds you, they get tremendous results. And we'll talk about success stories in just a second here. But if I could ask, what do you feel as someone that's no longer in active practice in a clinical setting in a hospital or a private clinic, what are the biggest challenges that you face running your business?
Well, the tech far outweighs any other challenge that I have.
Okay.
It's funny now that I'm out here and looking at all of the things that you have to do to run a business, because I really did never plan to be an entrepreneur. That is divine. It is not from me.
Okay.
It's the the learning curve is the word I'm looking for. It's the learning curve of all of the things, and the passwords and the this for that and the that for the other thing. It's all of it. I have enjoyed the learning curve, and I'm sure that that's really good for my brain.
Sure.
But it does make it challenging because you're only one person. So I now understand why businesses have teams of humans to do all the things.
Yeah.
Because it's a lot when it's one person trying to get started and scale.
Yeah. Well, thanks for sharing that. It's not
easy
to share.
And automation has been great too.
Yeah, that's good. Yeah, it's not easy to share where we struggle because we all do have it, but I think it's good when you could admit that there are some problems. You're always looking for some resolutions for that. So kind of back to patient care. What does success look like to you when a patient comes through your doors?
Success to me looks like them acknowledging that they may want some accountability and some help. Them having already started to think through what matters to them and why. And then choosing themselves. Like women don't choose themselves. We're conditioned, much like doctors, to take care of everyone else and to put ourselves on the back burner. So we're trying to pour from empty cups all the time. And that's exhausting and stressful and leads to illness. And if you're taking care of everybody else, at some point we need to look around and figure out, oh my goodness, who's going to take care of me? And so the woman who understands that she is worthy and that she is enough to take care of herself before she starts taking care of others is a success for me.
Yeah, love it. It's as silly as the airplane component where when the oxygen masks drop down, which I hope they never do for anybody, but when they drop, take care of yourself first. And it's very true. In many of the conversations with clinicians, physicians, entrepreneurs that are women, many of them make that statement. And of course, I, as a man, probably didn't believe it. Not that I didn't believe in it, but I didn't think of it. It wasn't as much of a thought process of mine. But when you say that and it's been repeated, and I think about my wife, it's the same thing, that there is a true component to that you're trying to do everything for everyone. And when do you take the time for me?
Right.
So that's got to be a big step for them.
Yeah. And so we talk a lot about self-care, because self-care doesn't have to be going to Tahiti to some fancy spa and being away from your family for a week. Self-care could be as simple as, you know what, I'm going to give my husband the kids. I'm going to go in this bathroom and I'm going to bubble bath for 15 minutes and nobody talk to me. It can be just that simple. We make it also very complicated, and it doesn't need to be.
Well, that's good. It's a small little tip and or trick that can help. It'll show my age, but I'll say, Calgon, take me away. That's what I learned from that situation. Yeah,
absolutely.
Yeah. So, Dr. High, would you mind sharing a success story of somebody that's come through your practice?
Sure. Let's see. I feel like they all feel really like good to my heart. But
Mhm.
one of my previous conventional patients reached out to me, and she felt like she had just gotten her cholesterol levels and was very upset by them.
Mhm.
Now, that I had already left classic medicine at that point. And so I was, first of all, honored that she thought of me to reach out. And so we started walking through, and I guess she had put on some weight as well. So she was just frustrated by the entire thing
Okay.
and wanted to figure out what to do. And so she came to me with just a little bit of motivation. That's all I need is a little bit of motivation. And we started with mindset. Okay, well, how did we get here? What are you consuming now? What are you willing to give up? What are you willing to add? Because I think adding is way more important.
Mhm.
And within almost 4 months, she was able to release about 20 pounds. And because she was pretty hardcore when she decided what she was going to do.
Mhm.
um, and we did it in a healthful way. And that's always the most important thing to me, is that we're not just restricting calories and doing really extreme things. We are really fueling our bodies in the way that God or whoever your higher power is intended.
Yeah.
Um, and then when she looped back around, her cholesterol had dropped about 20 points as well. So she had done really beautifully in a short period of time, just by managing her nutrition, managing her sleep, looking at her stress and how she was being mindful when those moments came up, looking at her social connection and her relationships and what you let in and all of those kinds of things. Certainly moving your body was important. And she was already somebody who wasn't necessarily engaging in risky substances like tobacco and alcohol. So we didn't have to really do much with that.
Okay.
But those are the pillars of lifestyle medicine. And writing prescriptions for that is now what I do, and
Okay.
customizing and personalized programs for women so that they can just walk in that. And then sometimes we actually get to decrease their medicines, and that's fabulous. Who doesn't want to be on less medicine? Who doesn't want lower copays? Who doesn't want less side effects? So that's what makes it so fun for me.
Yeah. Good. Well,
To
that's
do that.
good. Yeah, I love how you just said that. It made it fun for you. So it's enjoyable for you to be in practice. There's too
Yeah.
often that doctors are getting burnt out, just like patients are.
Yeah.
And how often have you had a patient come in and say, Dr. High, how are you doing today? In typical clinical practice, didn't happen too often, and mean it versus just a casual note. So that's good
Yeah.
to see about patients.
I had some really beautiful patients over the years who sort of followed me to all those different types of practices. And that's not to brag on me. What I say that for is it was very humbling that they entrusted wherever I chose to be to care for them,
Good.
myself and my partners at that time. Um, so I've had a good bunch of patients that are like that, who still keep in touch sometimes. So it's really nice.
That's great. Good for you. That means you've made an impact in more ways than you probably know, which is important.
Yeah.
Um, Here's a moment for you to kind of brag about yourself a little bit. From a differentiation standpoint, what do you feel that you do better than anyone else out there, and why should someone seek care with you?
Hmm. Wow. Um, I think that my lifestyle first approach um, makes people feel at ease, because they know that I'm not going to automatically hand them a medicine. And quite honestly, I partner with their PCP, so I'm really
Okay.
very much in the health coaching space.
Mhm.
I want them to keep that beautiful relationship with their primary care provider. Most people don't go to doctors that they hate. They don't. They switch.
Mhm.
Um, and so I want to preserve that. So their PCP continues to do everything that they do. Take care of your patient, do your medicines, procedures, screenings, all the things. What I do is I take apart the pieces that they don't have time to do in that 15-minute visit. They don't have time to do a 16-point assessment on all of the pillars and figure out which ones they need and assess what the patient's goals are. Often when you walk into a conventional medical model, your doctor has already thought about, because sometimes they've already seen your labs. They've already looked at your last note. So they've already walked into that room with their agenda for you. And then the patient walks in with their agenda, and sometimes they don't mesh. A lot of times they do, but they don't mesh from a 15-minute standpoint. And so I think that's where the burnout and the frustration comes from both sides, because you've got your hand on the door because you think you're done, and then they give you the, oh, by the way, I had chest pain. or the thing that you can't ignore while, all of the other ones are piling up. And so I would say the extended visits and the ability to listen and just unpack where they are and how they want to get where they're going is probably what sets me most apart from others.
Yeah. Thank you for sharing that. I appreciate it very much. Dr. High, what's the vision for your practice in the next 3 to 5 years?
My vision is for us to continuously grow and to have more community related events locally. I'm about to start a Walk with a Doc program here.
Oh, cool.
And so I'm excited to start building community in person, at least locally. And then I think I really see myself doing more speaking engagements, because I really do enjoy that. I didn't think I was going to, but I do enjoy sharing with like-minded folks, with skeptical folks. So that's kind of where I see us. I would love to have more collaborations with local businesses, just to, again, bring wellness programs to the community. I'm looking into some corporate events and sort of getting in the corporate wellness space as well. So we've got some big plans for the next 3 to 5.
You do. You're going to be busy, 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 it sounds like.
Yeah, I'm going to need that team, I think.
Yeah. I am going to share all of your links to your website, contact information, social channels, all that stuff. But if somebody's listening to this and they want to reach out to you, what is the best way for them to get in touch with you?
Yeah, probably our website's the best way. So that's www.NuEmpowermentHealth.com. And new is spelled NU as a nod to nutrition. So NuEmpowermentHealth.com.
Love it. And again, I'll make sure that that's in our notes in the show. So 2 last questions for you, Dr. High. A question is, if you could give one piece of advice that could benefit anyone or everyone's health journey in a positive way, what would that be?
There's so many. I would say recognize that you make a choice with every meal that you consume in terms of your wellness or disease.
Love that. So it's a consistent every moment choice once you're confronting the cabinet of food, the refrigerator when you're out to eat, always being in top of mind awareness. Yeah.
And if you're going to, if you're going to have that meal that's out of pocket, because none of us are perfect. I'm not perfect either. Try to do better at the next one.
Yeah.
It's not that complicated.
Love it. Simple but powerful approach. I appreciate that. So the last question for you, Dr. Patrice, you're on the Prime Health podcast. I do ask this. What is your definition of Prime Health?
Prime Health is health that is intentional, or health practices that are intentional. Paying attention to how you feel when you consume something, how you feel when you sleep or don't sleep, how you feel when you manage or don't manage that stress. Because awareness is really the key to all of it. We do a lot of things mindlessly, most things mindlessly, actually. Yeah. And then we don't feel well and we can't figure out why. So it's more for me about people actually just taking a beat. Life is so busy, but it doesn't have to be. Yeah. Take a minute and recognize, oh, I'm tired because I did such and such, or I didn't sleep well, or I didn't. And how can you do that better the next day so you don't feel as poorly?
Yeah. In life, being guilty is not a good place to feel, especially when it comes to health. It's a very difficult time at times when people have that. So, um, Dr. High, I really appreciate the stories that you shared about your patients and your personal choice to go into medicine, and then what really changed your perspective while in practice, as you share that personal story of what changed how you approached it. We don't wish those things happen upon us or anyone else, but in your case, it was a positive impact and a positive influence. So I do appreciate you sharing that. I always tell people that we would love for our messages to be shared. But I always say, if there's one person that you heard at church, at coffee, at dinner, a friend or a family member that could benefit from what Dr. Patrice has had to say and how she may be able to help them, it would be great for you to share this to that one person. Share it to as many as you would like, but just, if we could get that one person to make some active changes in their life, we would both appreciate that. Especially, I'd love for you to share the podcast. I would love more people to hear this, patients, clinicians, whoever it may be. But again, Dr. Patrice, until next time, remember that true wellness is a journey we are all on together. Now, whether you are taking charge of your own health or guiding someone through theirs, every step forward matters. Stay committed to your Prime Health journey. Take your time in that. Don't rush it. It's very, very important. And again, Dr. High, thank you so very much for being a guest on the Prime Health podcast.
Thank you for having me, Derek. It was a great time.